Hey everyone, it's me again. So I decided to make this video about questions that you guys post to me on the comments. So I'm going to read some questions and I'm going to answer them because I have a lot of um, very similar questions about my new career field and a lot of questions about the NYPD process that I started um, a couple of years ago. And I'm going to clarify everything with you guys. So let's begin. So the first question I have is from NPR 386. There's a couple of questions in there, so I'm going to try to answer all of them. Number one, can you touch on the duties slash tasks of aeromedical evacuation compared to aerospace medical services? Okay, to answer this question, I'm going to give you a disclaimer. As you guys know, these videos that I make are based on my experience and things that I observe during training and work. I am not a recruiter. I do not know if there is other venues besides what I mentioned. So it's always good to go to a recruiter and talk to them. But I'm just giving you guys my personal experience and opinions of things that I see and things that I find out. Um, so I can try to help you guys out a little bit on your journey. Okay, after the disclaimer, let's go for this. Duties and tasks of aeromedical evacuation compared to aerospace medical services. All right, everybody in the realm of health, enlisted personnel, right? I'm not talking about officers. I'm not an officer. I'm not going to touch on that. The only thing I know about officers in my realm of aeromedical is that they're all nurses. So they're all nurses outside. So I don't know what they do. For enlisted aeromedical evacuation, personnel had to go to aerospace medical services school. So as far as I'm aware of, everybody who's in the health career, in the clinic, ambulances, hospitals, aeromedical evacuation, we all started at the Aerospace Medical Services School to get our licenses to be able to practice clinically. Now, as a technician, all you can do really, vital signs, patient comfort. Do you need a blanket? I can assist you to the bathroom if you need. We do not administer medication. We only allow to do a little more invasive things like immunizations and things like that after additional training and sometimes under supervision. So there is a possibility that you're gonna do like an IV, you're gonna do phlebotomy, you're gonna do all those things, but it really depends on what your licenses are gonna be and what you're gonna be allowed to be doing. But your bread and butter as a technician is going to be vital signs, patient comfort, making sure that they ate, documentation, um, and still helping out whatever the nurse needs. If the nurse asks for, whatever catheter or a needle, things like that. So the schooling is for you to know the names of the equipment so you can assist them. So that's the similarity about both jobs, the duties that we do. Now, the difference in duty and tasks between aeromedical and aerospace medical services is that aerospace medical services, you are going to be on a clinic, you're going to be in a hospital. So you came out of school, you go to that building, and you work there. Aeromedical, you're going to go to a unit where whenever you have a mission, you're going to take all your equipment, do your inventory, do your function checks, check that all your equipment is good to go, and then you're going to put it in a little truck. Oops, sorry, I hit the little table here. You're going to put it in a little truck, you're going to drive it to your little aircraft, and then you're going to set up the whole thing, and then you're going to load your patients as a team, take care of your patients en route, unload your patients, hand off your patients to the next hospital or clinic they're going, and do all that documentation and then go home. And when you get home, you break down all your setup for your patient that you did before, and then you just leave your cargo aircraft the way that you found it. So the next question is it more critical care transport slash C-130s, or does it also involve Halo Medevac? I would like to do that later. Sorry, I changed clothes. I'm going to the gym after this video. But anyways, let's go back to that question. I'm going to assume the Halo Medevac that you're mentioning is helicopters. The Air Force does not, as far as I am aware of, we don't have medical evacuation in helicopters. We may be able to assist, and that I'm guessing. But I have never seen a helicopter unit in the Air Force. I do know that the Army and the Marines use a lot of helicopters, so I can guess that that would be the best bet for you if that's what you're interested ultimately is in helicopters. But let's go back to the beginning of the question. More critical care transport slash C-130. So also I'm not completely sure if I understand. Maybe I don't have enough information for you, but I'm going to try to answer what I understand in this question. So the med evacuation unit that I belong to, we work with more than just the C-130. We work with the C-130 and its variations, so the JDH and the other one that I forgot at this moment. Then you have the C-17 and you have the KC-135 and so on and so forth. So you have all of these aircrafts. And in my unit, we get qualified for patient care in any of these aircrafts. It does not matter which aircraft we're flying because we just fly off whatever is available. So the biggest thing in aeromedical evacuation is flexibility. So we are flexible with all of the aircrafts that we are trained on because it's not about which aircraft we're taking. It's about taking that patient out of wherever they are as quick as possible for their chances of survival. Now, at the same time, the aeromedical evacuation unit that I am at, we are more of a stable-ish patient kind of transport. So we initially, when we receive a patient to transport them with my unit, we do have the nurses, we do have the equipment, we have the patient care stuff and the training and everything like that. However, if it's not safe to transport that patient, we do not. The patient has to be stable enough that we feel confident that that patient is going to do completely fine for the whole trip. Now, if you have an unstable patient who needs to be in critical care, just like you asked the question, so moving on from the aircrafts, now it's been established that the aircraft doesn't have to only be the C-130. It can be any aircraft. And about the critical care, regardless of the aircraft, the aeromedical evacuation 4NOX1, which is the AFSC that I belong, we do not do critical care. We do patient care en route, but we do have enough training for if there's an emergency, a code, or something happens, we can take care of that patient to the best of our ability to keep them stable and safe. Now, if you want to work with critical care, the Air Force has a unit called CCAT. So that's a critical care training that if that patient is in a hospital and they need a surgery or to see a specialist or something that's not available at that one location, and they need to be moved to a next location, but they are not stable enough. So that patient is going to travel with a CCAT team, which is a whole team just for that one patient. And that's going to include not only nurses and techs, but it's always going to be a physician there as well, and all the equipment. So the equipment for the critical care will come with the patient. So you don't necessarily need to have a specific aircraft for the critical care. I think that that's what the question was, critical care slash C-130. The only difference between the aircrafts, as far as aircraft um, capability, is that some of them can go further away than others. Some of them have are newer or have more aeromedical evacuation and CCAT friendly uh, electric systems and things like that. But not necessarily if you have a critical patient, you need that one specific aircraft to move them. That's not a thing. Like we can take just about any aircraft that I mentioned, and we can just take our patients wherever they need to be. I hope I answered your question. Okay, so the second question is, how hard is it to get into the job field, either reserves or active duty? All right, so I am assuming that this question is about, you want to know if it's easier to get to that job as a reservist, or you should go active duty to get into it. All right, so the first answer is reserves. All right, so if you want to go into this career field straight away, you go as a reservist because you will pick the career field right away and you're going to train for it. As active duty, you need to go to aerospace medical services, serve for a certain amount of time, and then ask to shred out into medevac. So you would not lose, but you will have to be in a clinic and in a hospital as active duty for about 3 years. And also keep in mind that active duty um, has only, I think, 3 bases that do medevac, and only one of them is in the continental US. The other 2 are out of the country. So if you're active duty and you go into this shred out, there's 2 in 1 chance that you're gonna leave out of the country. Might be a good thing for some, might not be for others, but I'm just throwing it out there. Okay, so I am going to just do one more question, which is a clarification, really. I really stretched this video longer than I hoped to have. I didn't want to have anything longer than like 10 minutes. Thank you, NPR 386, for asking these questions. I hope I helped you out with this video. And if you guys have any more questions, I mean, there's plenty of questions that I can make videos out of. So I'm going to try and make more videos based on y'all's questions. Just keep asking. And there's one question that comes out at every video I make. So when I came out from basic in 2015, I took the NYPD test to become a police officer in civilian side outside in New York. Now, that was a very lengthy process because you have to not only take the test, but you have to get all of these paperwork, like any ticket that has ever issued to you or your car or anything that has ever happened to you. You need to have some paper proving that you owe nothing to nobody, everything is okay, you're a great citizen and whatnot. It's a lot of work, basically. So I went through all of that. I did a test. The huge impediment for me on that journey right off the bat was the fact that they take over 2 years to kind of follow through after you take the test and you are available, right? When you take the test, you are there. You want to start, you want to do it, you're there. But then 2 years later, life changed. I cross-trained to a new career field. I got new tickets, parking tickets and such. So things change a lot in 2 years. Um, and I've been trying to work on my nursing degree. And a huge thing with NYPD is the fact that once you get in and you finish all the training and the academy and all that, they want you to be on probation for about 2 years. And 2 years are 2 years. I right now, based on my age and my goals, I do not have to give for that career because I gave the 2 years waiting for them to call me, and now I can't give them 2 years and stop my schooling and the progression in this career field um, for that job anymore. So I'm probably going to not pursue the NYPD career at this point in time right now. Things may change because even though I'm out of the age limit that the NYPD would accept new recruits, um, military service helps you, cut back some years. So maybe in the future, if the math works out to my favor and things are working out better, I can go back to that process. But at this point, I I regret to inform that I am not going to go forward with NYPD um, because of my schooling and all that stuff. I know that you guys asked me how did it go, how is it going, if I've taken any new um, steps with that. So sadly, that's gonna be the step for now. It's gonna be no step. I'm going to leave it as is, and perhaps maybe in the future, if it works out for me, I'll try to go back to that. But right now, I'm just too busy with this career field. This career field takes a lot of dedication, a lot of time, and it will take a lot of compromise from my civilian life to keep it up. So I don't think that NYPD right now will be having a place in my heart, but it will always be in the back of my mind. I always wanted to do it, so maybe in the future I'll go back to that. Um, Again, I hope I answered you guys' questions, and thank you for bearing with me such a long video. And I'll try to post another video as soon as possible. I am not very consistent with the videos, but I try to, get as much information out there as I can. And thank you so much for watching me, and have a good rest of your day, and see you later.